So, should you be going to your doctor? I mean, if you're sick or if you're looking for health advice or whatever, should you be going to your doctor? Most people would probably say, yes, of course you should be going to your doctor. Your doctor is an expert on all things health. Whereas most raw fooders and probably most of you guys watching these videos will probably say, no, hell no, I won't go to the doctor. He or she can't do anything for me. So let's talk about what the role of the doctor is and the medical establishment in general, and whether or not there are times where it's useful and maybe other times where it's not so useful. First off, I just want to say that, this is not medical advice in the sense that I'm not here to tell you whether or not you should specifically go to your doctor. If you're in doubt, go ahead and go to your doctor, okay? I'm not here to offer professional advice in that sense. I'm just here to offer my personal opinion on how I view the doctor's role. So, first of all, let's just do some myth busting, because most people think that doctors know everything about health and nutrition and that sort of thing. Whereas the reality is, in general, I'm talking in general here because of course any specific doctor might have chosen to delve into some subject in depth and learn lots about nutrition or learn lots about some other topic, but most doctors in general do not receive any significant training in the subjects of nutrition and health. Because realize, health is not the same as disease. Doctors in general are experts on disease, pathology, sickness, symptoms of sickness, right? They essentially go through school, and the part of the reason why it takes so long is because, first of all, they need to be experts in anatomy and physiology. Basically, what is called what in the body? What's the name of all the muscles, all the bones, all the organs, and what do they do and how do they work specifically? So doctors are experts in that. Medical doctors, of course, that's what I'm talking about here. Experts in anatomy and physiology. What else? Well, they're also experts in pathology, as I said, experts in diseases and how diseases work, how viruses work, and that sort of thing. And then they're experts at hearing the patient talk about their symptoms and then connecting the dots, so to speak, between the symptoms and the various names of diseases. Alright, so this disease has all these symptoms and this disease has all these symptoms. And then they connect the dots and they give the patient a diagnosis. And then last but not least, they're also quite good at pharmacology, which is essentially drugs. So they hear the symptoms, they're related to a diagnosis, a disease, so to speak, and then they use drugs to suppress those symptoms. That's basically what the medical doctor does on a day-to-day basis. Of course, then there's surgeons and there's all kinds of specialists with specialized focus, and surgeons of course are experts as well on all those things that I just mentioned, but they go in and they do handiwork, so to speak, go into the body and actually repair things and constructive surgery basically. However, just because the doctor knows a lot about sickness and disease and how to treat the symptoms does not mean that they really know anything about health. As I said, they learn very, very little about nutrition. They go through pretty much, I've heard something like 10 or 20 hours only of nutritional training. So they don't know more than really, maybe a little bit more than the average person, but not much more than the average person. They also know very little about health, because health is different from disease. Treating symptoms is not really cultivating health. You can't really be healthy just because you have suppressed all the symptoms of your disease, if you know what I mean, or keep your diabetes in check or something by taking drugs. That's not really what equates to health. Health is a different state altogether. Absence of disease is part of it, obviously, but also a lot of other things are part of a healthy body and healthy functional physiological system. So in general, I would say this: go to your doctor for medical advice, go to your doctor for sickness advice, basically, disease advice. If you have symptoms of a disease, go to your doctor and get it diagnosed. But don't expect your doctor to be able to give you any advice on how you should live your life to be healthy, what you should and should not be doing in order to be perfectly healthy, and especially not what you should or should not be eating to be perfectly healthy, because he or she will probably not know anything. Yet they tend to be a little bit arrogant in that regard. They sort of feel like they know everything about the body because everyone praises them up in the sky as these kind of angels in white that just flow through the corridors and they heal. They're healers. You know, it's almost like a superstition where doctors are revered as healers, you know, because they have all these drugs and all this knowledge, and people go to them in their most desperate times. So it's a sort of emotional thing too, you know, like they're desperate for answers, and here comes a person that says, you know, relax, I'll help you out. And then naturally that becomes a very person that you start looking up to. So the doctors get this little bit of an arrogant attitude, some of them, not all of them, and they end up sort of thinking that they can tell you what you should do in terms of nutrition when they don't have any training in nutrition, which is kind of crazy. So then, are doctors at all useful? Of course they are. Of course the medical system and the medical sciences are amazing. We have gotten so far from where we were before. We understand much more of how the body works and that sort of thing. And so I personally like to use the doctor or the medical establishment as a tool. And I see it really useful in mainly 3 situations: diagnostics, emergency care, and constructive surgery. So diagnostics basically means testing, blood sampling, lab analysis, all kinds of imaging stuff. The doctor has a lot of different tools available to use in order to check whether or not you have a broken bone, or is it not a bone that's broken, maybe it's just a tendon, or what about your heart, how is it working? I have some extra beats on my heart that I've been suffering with for the last year, and I've been going to the doctor and they've been testing it and ultrasound and checking that everything is okay. So, you know, these diagnostic tools can be very useful, and the doctor's expertise in terms of anatomy and physiology and statistics, even seeing, you know, how does this heart look compared to most hearts, it's a valuable thing to have. So definitely use the doctor's skills and tools in order to get a diagnosis in certain cases. Next step would be then to cultivate your health, which would be something you do on your own. So don't shun the doctor just because they don't know anything about health. Well, they don't know a lot about injury and disease. And if you have any of it, if you have symptoms of a deficiency or something, go to the doctor, get a blood test, see what's going on in your blood. If you see there's a crazy iron deficiency going on, well, supplement with iron for a little while you figure out how to deal with the problem. Why are you iron deficient? Look at your diet, look at your lifestyle, and start working on building your health again. But in the meantime, it was very useful, wasn't it, to be able to go to someone with those kind of advanced tools and take a look at some of what's going on in your blood and actually get a diagnosis, okay? Of course, in situations like diabetes or heart disease, the doctor don't really know what's causing it. They don't really know about how health really works. So they might just prescribe drugs, and then for the rest of your life you can have diabetes, that kind of thing. And that's not really useful. But in the meantime, you know, okay, yeah, they've diagnosed the diabetes, they see what's the problem, they give you some drugs to maintain it. And then in the meantime, while you're doing that, or while you have your information from the doctor, you use that information on cultivating health and, you know, just eliminating the cause of diabetes, which is a high-fat diet, diabetes type 2 anyway. So you can see how it's useful to use the doctor's tools in that way. The other thing was emergency care. I'm very happy we have a medical system with ambulances and with all kinds of surgery and knowledge that can help us when we are, you know, get into an accident, or if we have a heart attack because we're eating so crappy. Hopefully, you know, someone will be there to save us. But then, of course, if we live healthfully, we wouldn't have a heart attack. So we need to have that combination of knowledge about health and take a responsibility for our own life, but as a backup system, as a safety net, so to speak. the emergency care services are very, very useful. I'm very happy that they're there. And even for a perfectly healthy person, it's possible to catch something like a very, very, very intense bacterial infection that maybe the human immune system is not equipped to really deal with, and using a bout of antibiotics might be useful in some cases. You don't really want to play around with your life. If you're in a situation where the doctors, they've seen a lot of these cases statistically, you're gonna die if you don't do this treatment, well, then you gotta really consider what they're saying, and maybe it's worth sacrificing your ideology for a little while, just because chances are slim that you will survive unless you take these antibiotics, for example, or some other treatment. Of course, there are gray zones, gray areas, because things like cancer, they tell you should do chemotherapy, radiation. Personally, I don't think that's a good idea. It's better to eliminate the cause of the cancer, cultivate health. I don't see how radiation, which is one of the number one causes of cancer, can also be used to treat cancer. That sort of doesn't make sense to me. But that's another discussion altogether, and we can go in depth in that another time. But there are certainly situations, in my opinion, where you need emergency care. It could also be something as simple as you break a bone, or you I don't know, you dislocate a shoulder. You go to the doctor and they help you get it back in place. It's really, emergency care is a great thing. So definitely useful. And the third thing was constructive surgery, which is, again, if you have a dislocated shoulder, or if you have, broken bone, that's just, you need surgery to get it back, or if you have some kind of, musculoskeletal problem, or even organs, constructive surgery can sometimes be useful in order to go in there and constructively move you in a better direction. Sometimes we need a helping hand, so to speak, If your arm falls off, if you're in a crazy accident, you lose your arm. I'm using these kind of blatant examples, but let's say you lose your arm. That arm is not going to attach itself, okay? Or let's just say a finger or something like that. But if you're quick, I think, you should be able to go to an emergency situation, that's the emergency care again, and then constructive surgery would be able to then reattach the limb. So, yes, there are situations, I believe, lots of situations where the medical establishment, where the doctor is very useful. And I highly recommend that if you are opposed to the medical system or the doctors in general, open up a little bit, because actually they have their place and it's an important one. But what you don't want to do is trust a doctor necessarily with your health, okay? They're good at treating disease with symptom treatment, which is not really eliminating disease, it's just keeping it in check. But what they're not good at is cultivating health. But I think this is changing. A lot of doctors are looking more into nutrition, looking more into health in general. The curriculum probably of the medical schools are also changing always. I mean, we are always learning, so we can't really accuse anyone of being malicious. We got to realize most doctors, of course, they want to help people. That's what they want. So it's just a matter of not really learning the right information maybe, and I'm not saying I have all the information. The doctors know a lot of stuff that I have no clue about. They know the details of how the body works. They know the details of our anatomy and various symptoms and various diseases and a lot of drugs and how they work and how they interact. The doctors are pretty good at that kind of stuff. But when it comes to how should we live our lives, what should we be eating, how much sleep should we be getting, well, then they're really no different really than most people. So best of both worlds, that's what I suggest. If you have a problem that you're worried about, if you have some symptoms that you're worried about, by all means go to your doctor. They're going to be an expert. They're going to look at you, they're going to hear what you're saying, they're going to draw some conclusion, they're going to give you a diagnosis maybe, they're going to do some testing with some advanced tools, come back with the results, and then you can use that information to do your research, to ask the doctor's opinion, to ask other people's opinion. Now you have some facts, you have some statistics, some metrics to go by. You know what's going on in your blood, you know what's going on in your body. The doctor's given his or her recommendation, and then you can choose to either use their recommendation in a temporary or permanent fashion, and then start looking into why did I end up in this situation, what can I do to prevent that happening in the future, and what is health all about, and how can I cultivate it? That's what I'd like you to do. Sort of take the best of both worlds, but certainly don't shun the doctor. They're doing a great job. Diagnostics, emergency care, constructive surgery. Let me know down below if you have had any good experiences or bad experiences with doctors in the past or present. I've had both myself, but I've realized over the years here that the key is to understand the limitations of the system. So rather than complaining about how the medical system is inadequate and they don't know anything about health and they just want to give you drugs, there's no need to complain about that, because that's their role. And so you just understand the limitations of that system. Bit of a long video today, important topic I think. Thanks for watching. Have a good day. Cultivate health. Use the tools available to you, including the doctor. This is not medical advice. Go to your doctor if you have any disease. And then I guess if you are interested in health coaching, which means just me helping you out on the journey towards better health, sharing some of the tips and tricks that I've used to cultivate health, be sure to check out our health coaching programs on our website, sweetnaturalliving.com. See you around.